Good afternoon, everyone. Welcome to the role of nutrition and weight in joint pain. My name is Machowsky. I'm an exercise physiologist and sports dietitian here at HSS. In today's webinar, we are very fortunate to talk about how nutrition and lifestyle can affect joint pain. And our guests today are Dr. Caroline Andrew, who directs the medical weight management program here at HSS, and Deborah McInerney, who is a clinical nutritionist here at HSS as well. Glad to have you both here, and thank you so much for joining us today and sharing your expertise.
Thank you.
Thank you.
Thanks.
So to jump in, the first question I'll ask is, what factors contribute to joint pain, and then how do body weight and nutrition play a role in that?
Well, I think there are a lot of factors that can cause joint pain or contribute to joint pain. When we think about joint pain, though, that's maybe been going on for a while, weeks, months, osteoarthritis is really the most common cause, and that's just when the joints actually start to break down. The cartilage in the bone starts to break down in the joints. And a few things can cause that. I mean, just aging in general can make it more likely for you to develop arthritis or breakdown of the joints. Genetics plays a role. If you've had injuries to your joints, that can, make it more likely that you would develop arthritis. In terms of weight, being at a higher weight, being overweight definitely can also contribute to the development of arthritis or joint pain as well. So, that plays a role. And Deb, nutrition, I'm sure also can affect it too.
Yeah, I mean, I think overall weight, I think that for a lot of patients over the years, if you have bone-on-bone arthritis, even losing weight will help alleviate some of the discomfort, but you still have a lot of damage already done. So again, genetics does play a huge role. So it's multifactorial, like you were saying.
Multifactorial, yeah. Definitely.
And so I think you both bring up a really good point that there's this kind of degeneration over time. So once you get to a certain point, you kind of are like, all right, I'm in pain, I have issues. What would your advice be from a preventative standpoint? What are things that maybe people could do before they have a lot of joint pain, or they have a little bit of joint pain, to help stem that tide?
I think from my perspective, weight loss, and we know that even a small amount of weight loss, 10 pounds, that can really help alleviate joint pain. When we think about your joints and your weight-bearing joints, right? Your ankles, your knees, hips, every kind of extra pound of weight that you have puts 4 pounds of extra stress on those joints. So from a weight loss perspective, if you could lose 10 pounds, that's 40 pounds that you're taking off in terms of the pressure on your joints. So you're going to feel a lot better with even a small amount of weight loss, definitely.
I also think that early action does something. So whether, so a lot of it's right, it's all circular. So someone has pain, they're moving less, then they're maybe not eating as good as they might have done. If they can't do the food shopping and they start ordering more, but then not going to the doctor or not getting it looked at just perpetuates that cycle. So then in 10 years time, I'm sure everyone has been to a high school or a college graduation, and, statistics show that people put on 2 to 5 pounds every year. And that's usually just between, we used to say Thanksgiving and the New Year, but even Halloween to the New Year. So if people are gaining 5 and maybe taking off 2 to 3, in 10 years, that's anywhere from 20 to 50 pounds without really trying. So to kind of nip that in the bud earlier and being as active as you can be in a healthy way. Because a lot of time it might not be joint pain, but it's muscular, or, I'm a big fan of physical therapy. So I always think, go get it checked out. And if you need to do physical therapy to strengthen everything around that area, why not?
Yeah, I completely agree. I think the earlier you kind of notice these symptoms, if you're having pain, the better, bring it up with your doctor and figure out what you can be doing right away to prevent any further issues down the line, to prevent getting to that point where it's bone on bone and there, aren't as many options. Definitely.
Got it. And that makes a good point. And then, so then we have another bucket of people who kind of maybe in the situation where you're kind of at that stage, there is inflammation going on, and you really want to try to manage that joint pain, that inflammation as best as you can. So from an inflammatory perspective, are there certain ways of eating or nutrition perspectives that you think could be helpful in this concept of anti-inflammatory eating?
So, I mean, I think that this is always, right, the question, and if we had a magic pill, we would not be talking about this anymore. I think that one of the things, there are sort of, people talk about pro-inflammatory foods and anti-inflammatory foods. And anti-inflammatory foods do not help if you are eating junk 90% of the time, but you happen to eat blueberries every day. So that's not necessarily going to help you, because there are tons of antioxidants which are anti-inflammatory, and antioxidants are like the fish oils, anything that comes from a plant, so anything with color, your fruits, your vegetables, so, and some of the other substances like spices or herbs, or even like onions. It's a vegetable that people don't really think, oh, there's actually antioxidants in that. So if you think about just focusing on your diet and really kind of getting all of the nutrients that you need, your fiber, your vitamins, your minerals, are also antioxidants. So if you're really working on best diet quality, it's not really work to then have to think about what my, anti-inflammatory foods are, because it's already part of your regular diet. So it's really, we've become over the years, and this is before my time, but when the TV dinner started years and years ago, and TV, tray tables and all of this eating in front of the TV, people weren't cooking a home meal necessarily to go sit in front of the TV. And now everything is ready to go, ready-made, processed. So anything that comes in a package has a lot more sodium, likely a lot more fat. And it's just, it's sort of food behaviors. It is about food, but it's really about the behavior associated with it. So whether you're cooking and eating more whole foods, or you're getting more of your foods as takeaway or more processed food, and what the percentage of your daily intake is processed versus fresh whole foods. So.
And I think that along those lines, I mean, that's when I talk to patients about weight loss, that's the kind of, I try to get them on a healthy eating plan that is actually just cutting down on the highly processed foods, cooking more and using more vegetables, fruits and vegetables in their daily lives. And that kind of eating plan is also going to facilitate weight loss if you are trying to lose weight as well.
Right.
And that's a great point. So again, it sounds like just eating more real foods, fruits, vegetables, healthy fats, less reliance on processed foods, packaged goods, stuff like that is going to probably be your best bet. I agree. That's the same thing I'll see within my practice too. It's just getting back to basics can sometimes go a long way, both from the inflammation standpoint and the weight management standpoint. So that's great. So of course, as always, we always get questions. Is there a certain supplement you recommend, or is there certain supplements that can help with this? In your practices, have you found certain supplements be helpful or not? Open to your thoughts on that.
Do you want to go first, or?
I'll just say, I think I have a lot of patients who take supplements. I tend not to recommend them because they are not, first of all, supplements aren't regulated. So when you buy a supplement online or at the store, you don't really know exactly what's in it. And so you need to be careful with where you're getting the supplements. And so that's the first thing. We don't have really strong evidence studies supporting the efficacy of these supplements. That's not to say that, I've seen some patients who take supplements and really think that they're helpful. So I don't discourage them from taking the supplements. If they're taking something like turmeric, that's a popular one, and they find it helpful, then that's okay to continue taking it. I just tell people to kind of be careful with, where they're getting them, and do your research a little bit into that.
Yeah, I think the supplements are always a good one because, again, like you said, it is not an FDA regulated pill or whatever you're going to get. And so you really just need to be careful. So you really are best getting your vitamins, your minerals, what you need from diet. Conversely, sometimes people, especially fish oil I feel like is the most popular, has been, especially in the ortho population. And so a lot of people notice that they've been taking it for years and they don't really know when they started taking it exactly, if it really helped them immediately. But when they go off of it for a period of time because they come in for having surgery or whatever reason, they just ran out and they forgot, they notice they feel worse. So for everyone, it's a little different. And I think we were talking about this before, that it certainly is worth a try if you want to try, taking something. I usually tell people, because a lot of people, if you don't have everything centralized, if all your medications are not centralized out of one pharmacy, or you go to different healthcare providers, someone might not know everything that you're taking. So you always want to run by some supplement or something new that you're taking by your doctor, just to make sure it's not going to really interact with anything else that you're taking. Yeah.
And that's a great point. I mean, turmeric, again, like you said, is very popular. Again, there is interaction with blood glucose levels, blood thinners, kidney stones. So again, even things that a lot of people take, like you said, like there are those interactions that, not everyone is aware of. So totally agree. So moving back to the weight management, as we know in the world, there's tons of diets, 10,000 ways to lose weight. Given the popular ones these days, keto, paleo, Ornish diet, what are your perspectives on diet plans and what works for you as a practitioner and your patients?
Yeah, that's a great question. There are like you said, there are so many different diets out there, and a new diet, it seems like all the time, that's promising you this, fast weight loss. But my perspective is that a lot of the fad diets, even if they work well for weight loss initially, most people gain some of the weight, maybe all of the weight back when they come off of the diet. A lot of those diets are very restrictive, so it's nearly impossible for someone to stay on that kind of plan for more than a few weeks, months, and so what happens when they need to switch back to eating more normally, and a lot of people end up gaining the weight back. A lot of patients who come to see me have been on a lot of different diets and have lost 100 pounds and gained it back and are very frustrated, which I understand. So in general, what I tell people is, if they're very motivated to try one of those diets, like paleo or the ketogenic diet, I'm supportive of that. They can try it out, but we need to be strategic about, down the line when they decide they want to stop that plan, how can we shift them carefully back to a more normal eating, and so we make sure they keep the weight off. That's my approach. So just need to be careful about it. But in general, if someone comes to me and they just want a recommendation about diet, I wouldn't recommend one of those bad diets or diet plans. I'd recommend something more sustainable, more of like a Mediterranean diet. Like we talked about before, cutting down on the highly processed foods, cutting down on fried foods. That's more of the approach that I take, just because I want them to, be on a plan that they can sustain. And that's much easier to sustain.
Yeah, it's really hard. I think there's a question of wanting to eat healthier or be healthier, or I want to lose weight. They're not often the same thing. And so a lot of people over the years, I may learn the hard way, but some patients will come in and be surprised that we don't hand them a diet plan. And then I say, but you just told me you don't cook or prepare food, so how are you going to do this? So yeah, like all of those fad diets, nobody can sustain them, because it's really it's unrealistic to think you're never going to eat carbs again, or you're never going to, and so when I hear people are, on a no carb diet, I think, oh, okay. You're portion controlling your carbohydrates. You're still eating fruit, you're still eating vegetables, which are carbohydrate sources. You're just not having starchy carbs. So it is one of these things in practice with outpatients for weight management, whether it's weight loss, eating better. A lot of times that people focus on all of the foods, because most people tend to think about weight loss, right, as everything that I cannot and should not be eating. So everywhere you go and everything you see is, well, I can't eat that, I'm not supposed to eat this. And it's hard, especially in today's world. You're constantly beating yourself up. So if you really focus on all the foods you can and should be having, it makes things just a lot easier. And it's a bigger group than the ones you cannot and should not be having. So it's really just kind of training your brain a little. But for people that really want to lose weight, you really have to be ready. So if you're not, the phases of change, if you're still in the pre-contemplation phase, like, oh, I really need to lose weight, you're really not there yet. But people really, I always recommend people to do one thing. Pick the one thing. It's sort of what I like to call lazy change. Smallest change, biggest impact. So if you drink a lot of liquid calories, if you drink a lot of soda, work on changing that. Work on decreasing the size, the amount of that every day for a couple weeks. It's just your taste buds have memory. So you want to just kind of alter it a little bit so that you want to drink soda all the time because you're drinking soda and your body wants normalcy. It wants homeostasis. So it wants to keep, craving and having that. So people, a lot of times what I've worked on with patients is just for 2 weeks thinking about having their portions of starchy carbs for the next couple of weeks until it becomes routine. And then you work on the next thing. It takes a long time to get a lot of really healthy, successful changes implemented to stick with over time. And a lot of people just don't have the patience level, but it does tend to work better. I had a patient lose 99 pounds over the course of a year. It was the course of a year, but she wanted to do it and she was able to do it and keep it off. And it was really impressive. But I told her from the beginning, this is going to take many, many months. And she was like, I know, that's why I'm here. I'm like, okay. So, it can happen if you do it.
That's exactly, I agree. I think a lot of people, and I understand this, people want a quick weight loss plan, like a quick solution. They want to lose the weight fast. And that's really not the most effective way to lose weight and keep it off. So, a more gradual weight loss is healthier. It's just, and I think, so we need to shift the way we look at weight loss and see it more as a long-term kind of commitment and a process. And, it's going to take maybe a year to lose that much weight. And that's the commitment that's required with regular check-ins with a nutritionist or with a doctor or whatever program you're doing. It's really a long-term commitment.
And there really are 5 methods of weight loss. There's diet, there's exercise, pharmacotherapy, medication, weight loss surgery, and the 5th is the combination of any of those prior 4. So obviously the diet and exercise work better because not everyone's going to necessarily just go and take a pill, and not everyone is just going to sign up for weight loss surgery, even though those are way more prevalent now and way more common now. But there are still, having the weight loss surgery is usually successful to a certain degree. Someone has lap band, someone has gastric sleeve, someone has gastric bypass, but if you haven't modified your diet habits at all, that is a really hard thing to sustain successfully to keep that weight off that you've lost. So,
yeah, and eating more vegetables and moving better is a lot less invasive too, I would say.
And cheaper.
Yes. And the other thing I'll say too is, in those situations I've had with people is, people get all down in the dumps that they lost, 2 pounds in a month. And I'm like, that's 24 pounds in a year. That's not so bad if we extrapolate. So I think sometimes the speed versus the sustainability is so important. So I think anytime we're asking ourselves about a particular diet, it's not just asking, am I going to do it now, but can I keep doing it, much to what you're saying. Because that's really what matters. If you lose 25 pounds and you gain it all back, it's not going to help you. We had a good question talking about with menopause and things and changes that happen over time in women, the effect it has on the ability to lose weight, sustain weight loss. Within your practices, how do you manage those factors for people?
That's a great question. I think it's a really common issue that comes up in my practice. So women who have gained weight with menopause or just finding that it's more difficult to lose weight, and that's due to a few things. Some of that is with aging. There's some change, obviously, with menopause. Changes in hormones can affect your ability to lose weight, and also changing your body composition. So how much fat versus lean muscle mass you have changes with aging and with menopause. There's some issues with hormone insulin with menopause. So I'm not going to go into too much detail, but very common. I think there is a lot we can do with diet, with changing an exercise regimen to help combat that weight gain. But what I do is, every patient is different. So I really need to I take a very individualized approach to weight loss. So I need to know kind of the whole story and see, and that helps me decide what your plan will be. But in general, just to answer that question, that is a common issue. And there are things we can do with whether it's, so a combination of diet, exercise, and potentially using a medication as well to help with weight loss if needed. Definitely.
Yeah, I think you just work with what you have and depending on what someone's scenario is, because again, maybe not losing weight is the frustration for certain people, especially women that are menopausal pre-post, but not having gained additional weight is also success. So again, diet and exercise, as long as they're physically capable to do some sort of activity, it makes the diet component less restrictive in a way. It definitely helps with your metabolism and how much you're able to consume calorie-wise. So.
Yeah, that makes a lot of sense between the exercise and nutrition working together to promote a calorie balance. That makes a lot of sense. So one thing, so you're both great professionals and people will be great to work with you both, but I think some people might have questions about kind of when does it make sense to go to like a dietitian, a clinical nutritionist versus, let's say, the medical weight loss approach. When does it make sense to go one versus the other? Do you ever go to both at the same time? How would it work for somebody who was interested in pursuing this path but wasn't sure who to go to?
I mean, I think we work together. I think it's there are benefits to seeing both a nutritionist and a doctor, a medical weight loss, so a physician who specializes in weight management. I think everyone benefits, anyone and everyone that would benefit from seeing a dietitian or nutritionist. You can always learn about ways to improve even if you're someone who considers yourself very knowledgeable about nutrition, there are always things you can learn and ways to improve your eating. People who come to me are really anyone who's interested in weight loss could benefit from just basically as a physician, I look at, what else is playing a role in your weight? What's your medical history? Do you have any medical conditions that might be affecting your weight? Are you taking medications that affect your weight? Some people are taking, pain medications, for example, that they don't realize may be increasing their appetite or affecting their weight. And so I look at that and a few other things as well, and then come up with a kind of treatment plan. And again, every plan is different because every person comes in with a different story. And we figure out something that works, that we try to come up with an individual plan. But I would say, we work together. The nutrition aspect is crucial, of course, as we've been saying this whole time. You need to have that foundation of nutrition to lose weight. So.
Also, I think that a lot of people that really know from the get-go, they don't want to have weight loss surgery and they don't necessarily want to take a medication, whether it's because they already take too many medications, they don't want to add another one, or they don't want to start medication. So for those people that are sort of all in and really are like, I'm going to try this and it's time, I'm ready, and they have maybe 10 or 20 pounds to lose, even 30 pounds, that's sort of the ideal patient for nutrition counseling. Because if you have, we have patients that are sometimes, have 40, 50, 60, up to 80, 100 pounds to lose. It is going to be a very long and slow and frustrated road for a lot of those patients. And the patients that have upwards of 30, 40 pounds to lose would more likely benefit from Caroline services than just the nutrition piece.
Yeah, and that's a good point because you're trying to get the weight down, but then also make it more sustainable. So there's value in both.
Yeah,
makes sense. Had another good question that kind of just brings us back to inflammation briefly. So we were talking a lot about anti-inflammatory, but also this concept of pro-inflammatory foods. So someone noticed for themselves that if they eat too much citrus, vinegar, coffee, acidic type foods, that they have more joint pain. In your practices, have you noticed certain food types or groups become more pro-inflammatory? Is it very individual? What have your experiences been with the concept of pro-inflammatory foods?
I mean, I haven't noticed everyone is a little different in terms of knowing what affects them in a negative way. Citrus I've not heard of, some of the acidic stuff, not so much, but most times I haven't heard anyone saying, when I eat this type of food, I feel more pain. Unless, yeah, that I've not heard, but I've heard conversely where they just tend to feel a little better because a little nutrition can go a long way. So if their diet quality improves a bit, there's better cell protection. All of the free radicals can't attack and, you know, break down our good cells. So that's what all those antioxidants do. But that's interesting. People are very in tune with their bodies. So, you know, I that's a first though. You know.
Yeah, I think I've had patients come in and tell me that they feel like they're sensitive to certain foods, and there's something to that. I think I agree. You do, you know, yourself, and you know, but in general, I agree with Deb. I think it's more that I hear that when people improve their diet, when they cut down on sugar, you know, then they feel a lot better, and you know, joint pain, for example, gets better. I have heard that from patients.
And it's funny because oftentimes, you know, sometimes you'll hear it say, oh, I went gluten-free and I feel better, which is interesting. But I always say, well, what were the gluten-containing foods you were having? Were they, you know, breads and pastries and other things? So I say, well, if you really want to challenge the gluten, then go have some barley and see if like a serving of barley is an issue. If
Then eating barley,
then you really was the gluten. So yeah, I think understanding what our eating patterns and habits are, and then our food choices, then sometimes these diets just make us change gears and go out of this kind of routine we had and get us into a healthier routine. So it's not to say that we have to take the 10,000 changes with the diet, but what are those, like you said, Deb, 2 or 3 key changes that can be sustainable to allow someone to make better choices reliably to then lead to that weight loss, I think.
I mean, I think that, you know, it's funny. I had a patient a couple years ago. She was about 48 years old. She and her husband decided to join a CSA, and she said, we just wanted to eat better or be better, you know, be healthier. We have 2 kids, and they ended up losing. She lost like 25 pounds. And of course, her husband, because he's a man, lost like 40 pounds in the same period of time. But she said it was so many fruits and vegetables that she said we just had to constantly eat it. We didn't want it to go to waste. And they just ended up, were so focused on all of the food that they had to consume in a week, because it was a weekly CSA, that they weren't eating out, they weren't buying junk. It just, you know, it was so, and so she was like, wow, she's like, we feel better, we this. And then you get like this kind of high from being proud of yourself in a way, like, oh, good for me, look what I did. And it's so, I think for a lot of people, simple things are, you know, water, drink water. You have at least a serving of fruit, vegetables a day. That's very basic, kind of 101. I laughed when you said about people saying I'm gluten sensitive, because I always, the first comment that comes to mind is, how much gluten were you eating? Because a lot of people, like a good friend of mine would have like a bagel in the morning, a sandwich at lunch, and then some sort of gluten-y, you know, carb at dinner. So every single meal was gluten. I'm like, huh, okay. So yeah, you probably feel a little bit, you know, better maybe without as much, but it's also maybe just excessive portions as well with the gluten-y foods. So, but the fruits, the vegetables, your lean proteins, I mean, the food guide pyramid, any of these people on this webinar, if you ever remember, that was so old, and then they redid it to a pie chart thing that nobody could understand. Even the healthcare professionals could not explain or speak to it. And now it's called My Plate. And so if you want to look, it's called myplate.gov, and you can go, and it basically, it's ideal. So it has basically all of the food groups that you should be consuming when you have a meal, but obviously no one is necessarily consuming that many, but it has all the food groups. So if you have fruits, vegetables, you have a dairy serving, you have a lean protein, you have beans or whatever, it is ideal. And if you are focusing on all of the things that you can and should be having, again, a lot of the other stuff falls to the wayside. So, you know, it's not that you can have those other things, but it's very much in terms of how we speak to people with diabetes now. Same thing is, there's nothing off limits. It's just, what is your usual 90% and what's the 10%? Because for a lot of people, that 10% is like 90% of their intake. And so that's where, you know, you just gotta, you know, swap it a little, so to improve it. But that's an easy thing, is just, you know, and a lot of times, if you're not getting fruits and vegetables, you are missing so many crucial nutrients and a lot of fiber and hydration. And it's summer, and there's a lot of science behind why summer fruit and vegetables are the more hydrating ones, because we're thirsty or it's warmer, you know, whatever, we tend to eat more. I know a lot of people will say, oh, I eat so much fruit in the summer. I'm like, right. So it makes sense. But it's a good thing. I mean, nobody, not one person, I bet neither of you or anyone on this webinar has ever heard someone say, my God, I gained 40 pounds from eating too much protein and vegetables. Or I was eating so much fruit, I gained 40 pounds. No one says that. So just, it is kind of, you know, you can really eat a lot of your nutrition, and that's really where you should be getting all of your nutrients from. So some people, if you think about that and just kind of, you know, not necessarily having to cook all the time, but there is a little bit of planning that goes involved into this. You know, what's my week like? Am I going to be out? I mean, no one's really going out as much now, but prior to that, you know, maybe people are ordering delivery now or takeout. But, you know, if you live in a house and you have a grill and you're outside, I mean, a lot of that stuff, it's a little easier to do some of that stuff, you know, so.
Yeah, I agree. I think it's, you know, like the back to basics, fruits and vegetables, lean protein, drinking water, and again, not telling yourself that you're going to not ever eat a cookie or, you know, something sweet. But having it be 90%, 10%, 80-20 is kind of what I use with patients. Have 80% of the time you're eating well, and then you have a little bit, you know, give yourself a break and you eat something you really want some of the time. That's the way to do it. And I think some patients, oh, sorry, I was gonna say the fruit, you know, I've had some people come to me saying they think they're eating too much fruit because there's sugar in fruit. And yes, there is natural sugar, but I don't think fruit is what is going to prevent you from losing weight. So I think fruit, I tell patients, don't really worry about that. Let's look at what else you're eating. You know, fruit has a lot of fiber in it as well. And definitely, I don't think you need to limit that. You know, that wouldn't be the one issue for weight loss.
Yeah, it sounds like a good nutrition prescription overall coming through. So that's what we should focus on: fruits, vegetables, lean proteins, hydration. Not worrying too much about fruit. That sounds great. So what I'd like to ask is, you know, given the situation now, are you both seeing, you know, someone's interested in doing an appointment with either of you? Are you seeing patients live? Are you doing telehealth? How can someone reach you both right now if they want to do a session?
Yeah, I'm seeing patients both virtually and in person. And I'd be happy to help anyone who's interested in talking more about this, about weight management. And you can find me easily on the HSS website and make an appointment.
Yeah, my colleague Sue is doing telehealth outpatient, but purely right at this moment telehealth. So not in-person appointments yet. That is down the road at some point, but yeah.
Great. Well, thank you both so much for your time today, sharing your knowledge and expertise. Thank you to everyone who has attended, who's asked questions, and is engaged with us. So again, that's all the time we have for today. Thank you for tuning in. If you have any questions or would like to learn more about HSS, feel free to comment below or visit hss.edu. Thank you for coming, everyone.
Thank you. Bye.
Take care, everyone. Bye.